Hello, I'm Dr. Barry Pecos, York Region's Medical Officer of Health. As you all know, this coming month of March, we will be marking 2 years since COVID-19 came to Ontario, with school closures on March 12, 2020, and a declaration of emergency on March 17th, and all of the dramatic changes to our lives that followed. But this week marks a turning point that so many of us have been looking forward to. Beginning March 1st, capacity limits will be lifted in all indoor settings, and proof of vaccination will no longer be required to enter indoor public settings. In alignment with this provincial reopening, our York Region Letter of Instruction for owners and operators of sporting facilities, updated last November, will also be revoked as of March 1st, 2022. This means that proof of vaccination for players, coaches, volunteers, and spectators will no longer be required to enter indoor facilities where organized sports are played or practiced. The proof of vaccination program has been incredibly effective in protecting these spaces and the individuals who use them, as well as making patrons feel more comfortable and protected. Many York Region residents and businesses have expressed concern about removal of the proof of vaccination program, and this is understandable. Individual businesses and organizations do have the option to continue to require vaccine passports if they feel it's appropriate in their setting. We encourage all businesses and residents to be kind and respectful as we navigate this very significant change. Over the past week, York Region and across Ontario, our hospital admissions due to COVID-19 have continued to decrease, but at a more modest pace. Wastewater data that did show a sharp decrease after the Omicron surge last month may now be showing signs of an increase again in the GTA, something we did expect, but something we need to monitor very closely. We're also keeping watch of the more infectious BA2 variant that has spread in other areas of the world. As almost all pandemic control measures are reduced, vaccination is our best and may be our only protection against the resurgence and the need to reinstitute measures. So it is more important and more urgent than ever to get vaccinated. Right now, there are only two pieces of our vaccine puzzle that are lacking: our booster coverage and our 5 to 11 coverage. Well over 60% of York Region residents in some age groups are boosted, but in other groups it is somewhat lower. I was excited to get my teenagers their boosters this Sunday, as were they. 12 to 17-year-olds have just become eligible this past week, and I would encourage parents to walk in or book an appointment for both themselves and their teen to get boosted to help us move closer to ending the pandemic and protecting them from infection or reinfection. The COVID-19 booster dose is 95% effective against hospitalization and severe illness in Ontario, and this is the best protection we have against the Omicron variant. The other group of concern is school-age children, of which over 60% have received their first dose, and most of those their second dose as well. But to protect in-person learning and these children for the rest of this school year and into next fall, we need to do better. York Region Public Health is beginning to transition from large-scale vaccination clinics to smaller community-based clinics to match the current demand for vaccines in York Region. Vaccines will remain available to our residents, but clinic hours and locations are changing. Please visit york.ca/COVID-19 vaccine and get your vaccine as soon as possible. Before I close, I want to acknowledge the events in Ukraine this past week and how it has affected individuals with connections to this region and all of us in York Region, and of course worldwide. The focus of public health is the health and well-being of individuals and populations, and war is one of the most profound, tragic, and preventable threats to health and well-being. I join everyone in looking forward to a more positive week and positive news on all fronts next week.